Hi everyone, my name is Tiffany Lee, and today I'll be discussing my summer internship project. Over the summer, I interned with the Medi-Cal and State Programs Department with Kaiser Permanente, Southern California. Today, I'll be discussing the Health Homes program that I worked on. So what is Health Homes? It is a program afforded to the states by the Affordable Care Act. The program is mandatory for the participating counties, which includes most of the Kaiser Permanente Southern California counties. The goal of the Health Homes program is to provide comprehensive care management services for individuals with multiple chronic conditions or serious mental illness who also meet one or more of the acuity or complexity criteria, including chronic homelessness and multiple inpatient visits. The Department of Healthcare Services, or DHCS, has provided a program guide detailing the requirements for implementing health homes. Each health plan is responsible for the outreach and enrollment of eligible members, the provision of care management services to the enrolled members, and the billing and reporting associated with this program. KP is responsible for making 5 outreach attempts within the first 90 days of identification. Currently, KB Medi-Cal does not have enough resources to meet the demands of this program and needs to put together a comprehensive plan to assess the resources needed to successfully implement health homes. For the scope of this consulting report, I will focus on the design of the outreach process to enroll members for 2 counties that will be going live first in 2019, San Bernardino and Riverside. I'll go through the literature review I conducted to better understand the outreach methods proven effective for vulnerable populations. I'll also go through at a high level the data analysis I conducted on the eligible population. So first, the literature review showed 4 key findings, so 4 categories of effective methods to outreach and enroll Medi-Cal members. This includes first, face-to-face outreach efforts, second, texting, third, engaging the provider community, especially those who already have an established relationship with the members, and lastly, focusing enrollment activities around acute care events such as ED visits and hospitalizations. Now, diving into the population analysis, there are a total of around 4,900 eligible members in the 2 counties, 60% of which have a SMI diagnosis or serious mental illness diagnosis. Over half of the population have at least 1 inpatient visit in the last 16 months, and over half of the population has 3 or more ED visits in the same period. There are around 100 members who have an ICD code for chronic homelessness, but is likely an underrepresentation of the actual numbers. So based on the literature review and data analysis, I want to recommend designing a target outreach method for those experiencing chronic homelessness. I recommend for the Health Homes program, outreach coordinator and housing navigator to partner together with local community organizations who serve this population, including food banks and homeless shelters. Outreach to the members who are not chronically homeless can make use of a combination of mail, secure messaging, texting, and voice messages. And since 44% of the eligible members already have an assigned KP care manager, an outreach attempt can be a warm introduction from the KP care manager to the Health Homes program. I also recommend embedding care coordinators in the emergency department and hospitals across KP facilities. To enable the care coordinators to conduct outreach in a timely manner, the appropriate IT systems will need to be built in the electronic medical record to alert the staff of any transitions. Lastly, effective outreach requires engagement from providers across the medical centers, and KPO needs to engage with appropriate stakeholders across the medical centers in the planning process, with, of course, the above recommendations in mind. Thank you for listening. Have a wonderful day.